Hello, and welcome to another exciting segment of our Senior Health Medicare webinars. Today we have Jim St. John and Nicole Davis here to discuss how to choose the right Medicare supplement company for your needs. So without further ado, take it away, Jim Cole.
Thanks, Courtney. Hey, it's good to be with y'all. Thanks for tuning in to this webinar. Hopefully you'll be more educated by the time we're done with this. But I've been in the industry about 5 years. I've owned my company or owned my own business for a little more than 20. So customer service and customer care is a high priority with me. So it's good that you're tuned in. Nicole?
I am Nicole Davis. I'm the account manager here. I've been with Senior Health Medicare for approaching 3 years, and this is what I do on a daily basis. Compare the companies, compare the plans, make sure all of our clients are where they need to be. So how do you choose the right Medicare supplement company? The first thing I want to start with is all the plans are government regulated. So no matter what company you're with, a Plan G is going to be a Plan G, no matter where you go, 100% the same coverage. So there's no need to overpay there. What you do want to look out for is the companies that heavily advertise. What that means is they've got a big marketing budget and they have to pay for it. Usually it's going to come through in the policyholder premiums, which for you is going to mean quicker and steeper increases. Of course, we do know from talking to everybody on the phone, daily basis, we all like the brand names, AARP, Blue Cross Blue Shield, but you're going to pay for that. You're going to overpay for that. And Plan G, like we said, is the same no matter where you're at. You don't ever want to sacrifice your coverage for a couple of dollars in premium, and that's why we're here to help you compare all the plans, all the companies.
Yeah, that's a great point, Nicole. And like I used to say, you're actually picking the plan to cover you. So Plan G is going to cover you. Then you choose the company that's going to abide by those guidelines. In other words, these companies can't go rogue. They can't pick and choose what they don't like or do like about Plan G. So that's really important to pick the plan, and the company's going to follow the plan. All right. Now, I guess what I'm going to cover is what are your loss ratios and why should you care? That's a really fancy phrase for claims. Beware of companies with high loss ratios. What does this mean, and why is it important? Because it's going to affect your rate. It's going to affect your premium, not just today but down the road. So I always share with my clients, don't just look for today, what the price is today or the premiums today. Look at what's going to be in 10 years. And that's really important to understand how a company runs their business for the long term. I like to say slow and steady wins the race. So if you have a company that has low advertisement, like Nicole just shared, and low claims, that's going to really keep your rates low. And the age of the plan is critical as well. Some companies are, they test Medicare. Medicare is a different animal. There's some really well-known companies that I will remain nameless right now, but they were in 1 year and out the other. So I just like to say at least 10 years in the game of Medicare. If you have a company at least 10 years, then they've seen the high highs and the low lows. They got the T-shirt, they got the hat. They've been there, they've been done that. So that's a good company to stick with if it's 10 years and more. Now, the next one is, will my doctor take my Medicare supplement, even if it's not well known? Now, this is a very misnomer here, because I've actually had some of my clients, because we like to stick with companies that have low loss ratio, that don't advertise. So sometimes you're not going to hear from them. You're not going to understand who they are because they haven't advertised, all right? And so they've called me back saying, the billing department says they don't take this supplement. Well, I've actually called the billing department personally, all right? Here's an example. I talk to the billing department and say, hey, listen, I want to make sure you take Medicare. You take Medicare. They say, yes, we do. Great. Because I just want to make sure you take my client's supplement. They said, whoa, what supplement is it? I said, what does that matter? If you take Medicare, by federal law, you take the supplement. In other words, the Medicare is the dog, the supplement's the tail. Or Medicare is the engine, and the supplement's the caboose. They go together, okay? So don't get fooled and don't get worried about, will my doctor take this or that? That deals with under 65, major medical, okay, or Advantage plans. So that's a different thing. But Medicare supplements, they follow Medicare, and that's very, very important. So don't be fooled by that, all right?
And you should focus on the companies that focus on Medicare. There's a lot of lot of companies out there offering Medicare Supplement plans where it's really not their ball game, as I put it. They might start out low, like Jim was talking. They might start out with low premiums, but the following year they're going to double or triple, and you don't want that. Many of the most popular, well-known companies don't specialize in the Medicare plans. Humana's got a great drug coverage, but their supplement, are you going to be overspending for that? That's where you need to call us. We're going to look at your zip code, your age, all the specifics that go into comparing the Medicare Supplement plans and companies. If you find a company that is following the Medicare guidelines, they all have to, they're going to treat you right. That's really what we look out here for. We keep a close eye on all the companies for a number of years before we actively start placing our clients there and knowing that it's where they're going to stay. That's our goal, is to put our clients in a plan with a company that they're not going to want to leave. We're always here for you to call and review your plans here at Senior Health Medicare, and we hope that when we place you in one, it's where you're going to feel comfortable and they're going to do right by you.
That's a great point, Nicole. And I played baseball, and I was a catcher. And when I told my pitcher, I knew my pitcher's best pitch. And when things got tough or we wanted to close them out, I said, go with your best pitch, your fastball or whatever that was. You got to look at companies and understand what their best pitch is. What's their fastball? Are they jack of all trades, master of none? So they do all these great things, and they're all these great areas of finances, but they don't know Medicare. That's very important to understand that the company that we're going to place you with knows Medicare. That's their fastball, and that's what they know best, and you'll be in really good hands.
Awesome. Well, we have a couple of questions here that we'll take. We have a viewer from Michigan. He says, Blue Cross Blue Shield has been in my family forever, so why would I want to go with an alternative company for my Medicare?
Well, it's the same thing we talked about with name recognition. Sometimes you want to look at the companies that aren't well known and they don't advertise because they want to keep their rates low and take care of you. I mean, we have companies that actually had a rate reduction last year. Would you like that? Is that unheard of or what? So a rate reduction would be wonderful, but if they have get this, if they have good claims, low claims we talked about, and they advertise, they're going to still need your premium dollars to feed their advertising dollars. So have you heard of Blue Cross Blue Shield? Do you see them on TV? Do you see them in the papers? Do you see them on billboards? The answer is yes, yes, yes. So if they have low claims, yet they still need your premium dollars to feed their advertising dollars, are your rates going to go down or up? That's the question you got to ask yourself. So that's what we recommend. Again, we're kind of giving you a peek behind the curtain of how these companies work, because you got a life to live. We don't expect you to know. That's our job, and we're going to help you with that.
Okay, in that same vein, we have a question here. So if my under 65 coverage took care of me my whole life, is Medicare different? Should I be looking at a different company for Medicare or stay with the same?
I say definitely you want to evaluate your options, see what's out there. Under 65 or employer coverage is a whole different ball game. Any type of group coverage, employer plan is going to work much differently than an individual Medicare Supplement policy. So when you call us, we'll look at everything that's available in your zip code, starting with the plan that you want. Most suggested is Plan G, and then we'll filter it then by companies and place you in a company that's going to do the right thing.
Excellent. Okay, this viewer from Florida says he had a friend that had to qualify medically to get into a plan. So do companies have different rules for this, for getting qualified under Medicare?
They do. It depends on what age you are. If you're in open enrollment, there are no health questions. There are no pre-existing. But if you are losing, coming off employer coverage, you also have your special election period. Like, in other words, your own special open enrollment period. So basically, what we want you to do is, yes, it is different. And so, what we need to do is be your advisors, guide you in this direction, and make sure that you are on the right path, because there's a lot of ins and outs with this. And so we want to make sure that you're in the right hands and the right path.
Excellent. Okay, we have one more question here. So what does it mean if a company is coming out at a market rate?
Start lower.
Yeah. Okay. Well, sometimes they call them cost leaders in stores, okay? They get you in the door because you're like, this is great, and then obviously you're going to pick something else and you're going to buy more things, okay? So, again, if they come in with a really low rate, all right, now what that means is a lot of people go by price. If they're not educated and they're not advised properly, they're going to get basically cater toward the price or the premium of that. We have actually some companies that actually price them out of the 65 a little bit higher because they want someone like you, an educated consumer, and they want you to know what they're doing, and so they have a healthier group of people. If you have a low rate, you have everybody going in this good, the bad, the ugly, no offense, okay? And guess what? That's going to affect your claims, and that's going to affect what? Your premium and rate increases. So we will make sure that you're in the right position with the right company that is not going to come in with this low rate just to get you and all of a sudden raise your rates later on.
Okay, awesome. That's all the questions we have for today. So thank you very much, Jim and Nicole. And I just wanted to say real quick, Senior Health Medicare, we're nationwide. We can help you with all your plans. You're going to see this on the website, and our 1-800 number is listed there. Our website is www.seniorhealthmedicare.com. We do have all the companies and all the different plans, so we can help make sure you're in the best, most cost-effective coverage for you. Thank you for joining us today, and stay tuned for many more exciting topics from Senior Health Medicare. Have a great day.
The moderator has left the conference.